and small retail business. The county's been gracious enough to have a number of these town hall meetings for businesses and for the rest of the county. We just thought it would be, with the restaurants just recently opening, it'd be good to hear what's happening throughout the county, both good and bad, and it may help some of the people that are opening their businesses. And so with that, we sent out a generalized statement for social media and to all of our partners in the more populated areas: Blissfield, Hudson, Adrian, Tecumseh, Morenci, but opened it up to the entire county. But anyways, welcome everyone, and we want to welcome everyone's input. We have Martha Hall from the Health Department and Casey Johnson with us, who's their environmental person, so that they're aware of and can help out on any of the things that are required legally. And of course, Marty Marshall and Kim Murphy from the county, who have held a number of these town halls, so they can make sure that we're staying in line here. So we welcome Chris from the city, our partner. I don't see any of our other partners there now, but if they jump in, we'll let you know. So with that, we did get a bleep from up north, from Traverse City and the Leland area, once they opened, talking about some of the things they did. And we just made a note of some of those things that we'll just go through here real briefly on what happened up north a little bit as they opened. And you may have seen some of this already down in our area, so it may not be a surprise to you. But some of the things that they did is they removed all of their seating in the front of the house of both retail and restaurants, so that social distancing was there and people couldn't go to those seats. In some cases, they put hand sanitizers on every table. The interesting one I found was plexiglass in the bar areas, and I guess Martha or Casey, I don't know if you can comment on that. The last I heard, that bar areas had to be closed, but if they put plexiglass in there, is that a viable alternative?
I don't know if you want me to take this one, Martha.
Go right ahead.
So basically, and we've heard of some places doing things like that. So the bar can be really difficult because it obviously makes things, typically your bartender is not going to be 6 feet away from your customers, and your customers aren't going to be 6 feet apart. So if you're not able to get 6 feet, one of the things that you can do is set up partitions, and plexiglass is typically the one that we see the most because it's clear and still obviously allows you to see people. So by no means are bars just, somebody I think mentioned that, I think I had a restaurant owner call me at the very beginning and ask me that. They're not by any means just completely closed. That's not written anywhere. Some places may opt to close them if they feel like they can't get that distance, or they can't, partition people off from each other. But I believe if you can do that in place, and you can do it in a way that meets those requirements, then you could certainly do something like that.
Oh, good. Well, good to know. Okay. Another one of the things they did is they moved hostess stands outside. A number of them have limited the timing that people come to dinner to an hour and a half, and they've put it right on their menus that, we ask people to limit their time within the restaurant to an hour and a half so that they can turn tables over more, which can't blame them for that. A lot of them are opening earlier and closing later to create more volume. In some cases, they had enough problems with people coming in, and we've heard this recently in our county too, is the people come to the hostess stand or the front stand, and they're a little irate because they don't want to wear a mask. They don't want to obey by the rules. Up north, they said they had to take some of their younger people. They had younger people that they assigned to those jobs because those were the people with less experience, and they could just, take people's time and sign them in and take them to their tables in the past. But as people started challenging them, those young people weren't able to, handle those as well as a more seasoned person was. And so they had to take a more seasoned person and put them at the front of the house to handle a number of those situations. They also, because of the the amount of equipment that they had to put in place for dividers and sanitizers and masks and whatever. A number of them put a surcharge, a PPE surcharge on their menus of 5%. I'm not suggesting any of this to anybody. I'm just telling you what's going on, okay, so that you're aware of it. I will tell you that in every case where they put on a surcharge, not one of them said they got a complaint. People were happy that, the place was open and was very, very understanding. But, needless to say, their food costs are up, their labor costs are up, and so they're trying to cover a bunch of that. And of course, then they talked about open streets and outside seating to add capacity, which we've heard a lot about throughout Lenawee County, of people working with their local areas to see if that can happen. So those are just some things that, were brought to our attention that we wanted to make sure that, one other thing is that in a number of instances up north, they found out that it was much easier putting one person on serving, one person on busing, and one person on serving drinks. So one person served food so that they didn't have to worry about, all the desanitizing in between. So those were some of the best practices, or the worst practices, as you might look at them as they go ahead. So with that, I mean, we just wanted to basically say, is there anything here that, the county, the health department, or any of us and our local partners here at Lenawee Now and down at Economic Development in the city, is there's anything that we can do to help out, or if you've had good or best practices that you would like to share with other people so they have a better understanding, we're open to that. And so with that, we'll just open it up to whomever and go forward from there and see what we come up with. Not hearing too much. Has anybody had any problems, much like some of them that we talked about? Okay.
I'll go ahead. So one of our concerns at Downtown Dempsey's is that we've had, a number of people who, like you said, they don't necessarily want to wear PPE when they come in. But where we get concerned is, it's our responsibility as a restaurant and as a business to enforce those practices, but there are other restaurants maybe in the area that are not necessarily doing that. So, I mean, how would you suggest that we enforce that without losing our valuable customers at this point in time, while still complying with, the health and safety standards? I mean, that's one of our biggest concerns right now is, people have a lot of strong opinions about wearing PPE in Adrian and in Lenawee. And we just don't want to upset those customers and have them go somewhere else. I know that there are several restaurants in Adrian that I've been to that are not complying with that. So how do we compete if it's not being enforced everywhere?
I'll take that one. If you would like to, and I realize this can always be a little bit complicated, but if we're aware of the situation, we will certainly reach out to those restaurants and make sure that they're aware of the requirement for everybody to wear a face mask as they enter the facility, at least until they get to their table. And we'll be more than glad to have that conversation. It is a complaint-driven process with regard to enforcement. So if we're aware of it, we will reach out to them. And there have been some situations where we've reached out to people and, have been able to kind of turn that around. Sometimes we're, providing them with the cloth face coverings. We have been accepting donations of those, and we then provide those out in the community. So certainly, if you want to share that information with the environmental health team, we will be glad to do that reach out.
Thanks, Martha.
You're welcome.
Go ahead, Brett.
Oh, no, I was just clearing my throat. Sorry.
Okay. Anybody else?
Actually, I do have a question on the enforcement side. I mean, is there like a structured enforcement setup, or like verbal warning, written warning? Are there fines involved? are the employers paying the fines for the employees that are not complying? Because I know in the alcohol industry, we take the hit, the owners, regardless, even if they committed a crime by handing out alcohol, we still get fined for it. So, on the enforcement side, what's the structure to it?
So, Brett, the enforcement is really what I just described. It is us reaching out to them and having that conversation, making sure that they are aware of what the requirements are. We've not encountered situations yet where it has needed to go beyond that with regard to the face coverings. And this is a little different because it is an executive order rather than part of the food code. So we will do our best to work with those individuals and make sure that they are in compliance. As far as employees doing it, I think that the employees are bound by whatever the requirements are of the owner of that establishment. So if your establishment requires that they follow the executive order and wear a face covering, then ultimately you would have the ability to be able to make a decision on what happens with that employee if they're not doing that. And as far as fining or anything associated with that, I don't know how that would work with the executive order. We have not been at that point with these.
So basically, Martha, you just, right now, if there's a complaint, somebody just goes down and talks to them, and that's been working?
For the most part, when it's brought to somebody's attention, even if there is, we've been told in some situations that, well, we didn't have cloth face coverings. This was more in the early on when we first started reopening. They didn't have them, and so we were able to provide those cloth face coverings. Sometimes, a lot of times, just bringing it to someone's attention. Some people were under the impression that it was optional. And the executive order indicates that you're supposed to wear a face covering when you're in public spaces. And then it's even more specific when it comes to food selling establishments with regard to employees as well as anybody entering that food establishment.
Okay, good. Another thing that I might mention to you is I was talking about what happened up in Traverse and Leland. They said that it really helped them a lot going on social media or their Facebook or their webpage or wherever it was. They found out that people were really using that to find out what the rules were for your establishment and what your hours are and any other needed information that they needed to come into your business. So you might want to think about that too, as so people are looking at websites to figure out where they're going to go and because a lot of places are open. A lot of places are open, just for dinners and not for lunches or specific hours. And so, it's probably a good idea to get that up on whatever social media you can so people can look that up.
Yeah, I think that's a really good point, Jim. And I have seen where some of the establishments locally have done that, and they very clearly put it out there on their social media that these are the expectations when you come to our facility. And I believe that probably helps them in the long run.
Right. Good. So anybody else had any experience they want to share with us there? Or questions?
Hey, Jim, Mark here. Couple things. One, still small businesses trying to locate cost-effective PPP. It's still a struggle. We attempted to utilize the web portal that the county offered, and as a small business, it's just really hard to get those kind of supply sources in place. I think we should just continue to look at how we get the disinfectants and other products that aren't on the shelf at Sam's or places that we would normally have bought. It's better than it was. It's still not really easy to get the stuff that we would like to get, the sanitizing solutions and the quantities that we'd like to have for our business. Just wanted to get past that on.
Sure. Any updates, Marty or Kim, on availability. I mean, we've been working with the state. They've, come out with some bulletins that are on our webpage you can look at, but I don't know if the county has any update on that.
We're still not able to get everything that we previously got either. And, we are able to get some hand sanitizer. In some cases, we have to bottle it ourselves. We get it in larger quantity and bottle it ourselves. It's, I don't know quite why that capacity has not ramped up. We're like 5 months into this thing and we're still dealing with some of that stuff. I don't know that we'll ever see in terms of cost, I don't know that we'll see for quite a while a return to the cost structure that we saw months ago, because, some of this stuff that used to come from out of country, it's not readily available from out of country anymore. And the manufacturer in the United States is able to command a higher price right now because of the shortage of that stuff. And of course, with what you're seeing going on in the southern part of the United States right now, with this resurge of the virus running across from Florida all the way out to California, we don't yet know what that'll do to the availability of PPE and cleaning supplies and that kind of thing either, because you're probably going to see a jump in demand in those states where the outbreak is really increasing. The numbers this morning on a rolling 7-day average, both Texas and Florida are at about 36% increase on a rolling 7-day average. So you're seeing thousands of cases a day added in those states, and how that impacts availability of PPE is yet to be determined.
Okay. Good information. Anybody else have questions? Or Chris, you got anything in the city? May want to unmute Angie and see it.
I guess wanted to make sure that for the restaurateurs who are on the phone, thanks, number one, for doing that. But
No.
we would love to help out with whatever challenges you have. Some of those might be geographically specific, but some of them might be industry-wide. And I know one of the concerns that I've heard expressed by several restaurateurs are the costs of sort of the ongoing deep cleaning. And I know a couple of restaurateurs who are on the call right now have hired staff to bring on. And again, I'm not suggesting that maybe we can solve that problem, but if there's something that can be articulated now that we can take to our legislators or other sources of funding or other sources of support, it would be great to hear it if there is anything that has not already been shared with us.
Good point.
Jim, Mark here again. Just would like to throw in one kind of generalized comment. Just really appreciate the county and the state officials in Michigan really doing a great job at helping to proactively work on this, the problem we're all having. Unfortunately, it's, nationally, it seems to be pretty much a disaster in terms of the leadership, because we have people in our business that are coming in now, and as much as we want to encourage and enforce the mask, it's so difficult to do that without, stronger leadership from nationally and also some level of enforcement. So none of us want to see what's happening in Florida, Texas, Arizona, and we've done a wonderful job not to see that. But I think the next 6 months are going to be critical for all of us to figure out how are we going to keep our numbers down. And, the simple solutions are masks, social distancing, hand washing, the basic things. And I just, I'm frustrated to see what's happening in our community around people not following those guidelines. and our inability as a small business to enforce that because of the national political scene and whatever else. But if we're going to win this 6 months from now, we have to work really, really hard to enforce those basic rules that are going to keep us all safe.
Good points, Mark. I agree. Yeah, I think the last thing we want to see is a resurgence here in Michigan and have more restrictions placed on us or reinstitute restrictions. So.
Yeah, absolutely. And, you know, when we look at those numbers, like the numbers that Marty mentioned, and we see what's happening in some of those other states, you know, we really should be looking at this, you know, very cautiously as we approach the next few weeks, because it is going to make, it is going to help determine what happens. I mean, even with our children returning to school in the fall, those are things that we know that it's really important that the kids go back to school in the fall. So how do we do that safely? And it is very unfortunate that some of the things that are so simple, such as social distancing or physical distancing and wearing a cloth face covering in an enclosed public space, that has become a kind of a hot button topic rather than just the very common sense prevention that it is. So those are going to be very important things as we move forward.
I agree, Martha. And I guess my question is how are you working with our higher educational institutions as we, you know, with the colleges start bringing the students back? Right now, we've got people from Lenawee County, and we all know where we're at, but we're going to start bringing people in from all over the United States and, quite frankly, all over the world. So is the health department working with the colleges, and are they doing their own thing for making sure that we're meeting all of the requirements to hopefully keep this contained?
We are working with the colleges as well as having conversations with those superintendents in K-12. So there is ongoing discussion, you know, with those institutions.
Good.
Because it definitely is going to bring new challenges.
Right.
Because as you mentioned, with the colleges, we'll have many people coming in. They're looking at some different things to be able to, you know, try and reduce that risk as students return to campus, and putting some measures in place. So yes, those conversations are taking place.
Okay, well, we just wanted to get everyone assembled and see if, you know, anybody had some practices that they wanted to share with other people of, you know, what's working for them, or any incidents that they've had that they ran into that can help people understand what they're going to run into. So we wanted to get everyone together, but if anybody has any others, if not, we'll adjourn the process.
Jim, can you hear me?
Yes, Dave, go ahead.
Yeah, I just wanted to say at Sauce, what we've done is we actually hired a person full-time. We're only open for dinner now. We're not doing lunch. But we hired someone full-time as a sanitizer. And that person's job is to do nothing other than walk around with a bleach solution, hydrogen peroxide solution, and sanitize door handles, bathrooms, tables, chairs, trying to make our customer feel confident and safe.
That's great to know. And that was one of the things in our notices that we got from up north, Dave, when you're talking about Traverse City and Leland area, that a number of restaurants up there hired a person just to do that, and also to make sure that everyone was meeting all of the regulations so that, you know, their customers felt safe. So they put that person in charge of that. That's good to know.
Yeah, and you know what we're noticing is we've been open just a little over a week, but the customers are still scared.
Oh, yeah.
Without question.
You know, as they should be. I don't want to be the bearer of bad tidings, but I was doing my annual physical, and I see Dr. Decker. I think we all know in Lenawee County who Dr. Decker is. He's a good pulmonologist, and he's still scared. You know, when you start having a doctor that tells you, people don't get it. This is still very serious, and it's going into the rest of the year and into next year, and people better take this very seriously. I mean, he's very concerned. Yeah. Tiffany, you're on mute, Tiffany, if you're trying to talk.
Well, I was just thinking more to Chris's question. I know there's not too many people at the health department who are going around and policing, just, you're short on staff, but is that something maybe we could ask our government for help as temporary workers to help enforce these rules right now so that we're all being safe and all of the restaurants have to comply and just not, the ones who either pretend to not know or don't know about the new health practices?
Who wants to jump in on that one?
Well, I don't know that we are necessarily opposed. The problem stems from what, and Martha alluded to it, touched on it a little bit, what the enforcement mechanism, what underlying enforcement mechanism there actually is. And we have had a couple of businesses that have been referred to the Attorney General's office, for example, because in many cases, the enforcement is really centered around licensure that some of these businesses have, particularly when you're dealing with, bars and liquor licenses and, restaurants with a liquor license. That's a much more effective enforcement mechanism than, any type of ticket or fine or something of that nature. That's why you're seeing some of the compliance that you're seeing in the salons and the barbershops and that kind of thing. All of those folks are subject to state licensure. So, I think there is a argument to be made that enforcement would improve, but part of the problem with this is just personal responsibility. We can't seem to get people to understand that basic element that Jim just pointed out, that this thing is here, it's real, and it's going to be here for another, probably at least 10, maybe 12 months before there's something out there, a vaccine or treatment that makes it not quite as serious for people to contract the virus. And I much like Jim, much like Mark, I don't understand why people don't just get that this is very serious. If they all took reasonable precautions and some personal responsibility, we could do a whole lot more of this stuff that we all want to do instead of dancing around over the technical issues.
So to that end, Marty, and I really appreciate the county's leadership in all of this time and the reasonable and I think smart decisions that the county has taken and has promulgated. And as Tiffany points out, there's sort of unevenness to this, and as Jim and others have articulated, it's challenging when there's not a sort of clear message. So I'm wondering if we can talk about this, even in a more forthright manner than we've done so far on the county level, at least, where we have the ability to work together and just talk about the fundamental, basic kinds of good behavior that, the golden rule behavior that we all, know and recognize and say, that it's really important. And the size of the sacrifice that we're asked to make is so small here in the grand scheme of things. When we look at other times in our history, globally and locally, where sacrifices were much more significant for the public good. And so maybe we can work on some messaging and all of us be talking about the reasonable nature of wearing a face mask and working at social distancing. And, maybe that's a way we can separate ourselves from some of the politics that unfortunately are surrounding this issue.
And that's the exact, Chris, that's the exact messaging that we have had out there for some time now. We went out and hired a film crew, and we made some messaging concerning masking and protecting volunteers and protecting workers and protecting public health people. And it was as simple as wearing a mask, as simple as respecting those individuals in their workplace and respecting those individuals that are providing us with service. And every time we push out a post, it's jumped on by these trolls who push back against the wearing of a mask as though it's some kind of an infringement on their individual rights. We've got a troll that pushes out a picture of a mask box that tells you it does not protect you. Well, people miss the messaging. You're not wearing a mask to protect yourself. It's not an N95 mask. It's a surgical mask. You're not wearing the mask to protect yourself. You're wearing the mask to protect the people around you. And none of that messaging, I don't want to say none of it helps. I think it does help. But there's certainly a segment of our population that pushes back every time that we push that messaging out. And we've spent a fair amount of money advertising. We boosted these posts so that they reach more people by doing Facebook and Twitter advertising. I don't know, Kim. I think we've probably spent $50,000 on this campaign so far, trying to get the message out. And when we get feedback from professionals in the business, they're fairly pleased with the messaging that we're doing. The problem is we have this core group of people who are just solidly opposed to whatever we say about it.
But I think
I sure didn't want to throw any water on the work that you guys have done. In fact, as I noted, I think what the leadership from the county has been really extraordinary, including the media campaign. I'm just looking for a way for more voices to join that, and in some sort of a structured way. I was thinking about this morning when all the NASCAR drivers came together in support of the one black NASCAR driver who had a noose hanging in his garage, and that's a powerful image. And maybe there's some things along that front that we can do, where we bring all the leaders together and the restaurant owners together and say, hey, look, we're about protecting everybody's health. You're asked to wear a mask so that the people, as you point out, who are serving us, the heroes and the people who are willing to be in those relatively dangerous indoor environments for their employment, need our protection. So I really appreciate your leadership and what you guys have done, the resources that you brought. I'm just looking to see, is there a way for us to more broadly make that statement and really express how important it is to all of us?
Yeah, I think that's a good point, Chris. And I think, I echo Chris's point on the county. You guys have been very proactive. And maybe what we need to do, Marty, is work together to not only show a united front here, but also publish some of that information from Florida and the southern states that say, this is what we do not want to happen in Lenawee County as we all come together to unite. We don't want a resurgence like they're getting, and we need to make sure that people are aware of what's happening in those communities where they're getting a resurgence of it to offset the people that are, fighting the process.
Jim, Mark here, just real quick, looking ahead and assuming the worst, if we have another set of restrictions that come into the community, I highly recommend our state and county to take a look at a different approach. Instead of determining who's essential or not, let's say that any business that's following these 6 guidelines is going to remain open, and when they're not following them, they're going to be shut. So if masks is on the list, my business will be shut if I don't enforce the masks. So somehow or another, we need to be ready for that next decision matrix and it shouldn't look like the last one, and we should use enforcement as part of the tool to get the job done.
Hey, real quick, picking up on what Mark was saying, I read a study that Red Robin put out about, the different customer bases, demographic on who's going out, who's not going out. And, 25% of the population just refuses to go out. That 25% is just basically gone. 25% of the millennials say that they don't really care. They'll go out. It doesn't really matter. It's that 50% chunk that says, they'll go based on who they feel is the safest place to go to. So, is there a way that maybe the county can put together maybe a voluntary safe list? Maybe each restaurant or bar or whatever business wants to have some representative come in and take a look at their policies, procedures, and then maybe there's a Facebook page or something that says, hey, these people have been I wouldn't say certified, but reviewed to be safe, and so it kind of creates almost like a who's who list of who are the people that are kind of taking that extra step and who are the people that are not taking the extra step. And it's been verified by somebody. It could be just, maybe paperwork and pictures sent in to somebody and they look at it, or maybe somebody, just kind of goes out on a certain day and looks at it and looks at their operation. So it's kind of instead of really trying to just put the hammer down on some people and fines and enforcement, people calling in to, kind of, complain about others and stuff like that. So, but that, the study that I read from Red Robin basically said that, people are going to focus on who they think is probably the most safe and, what are they doing to be safe. So maybe by promoting the people that are taking the extra step versus pushing down the people that are not taking the extra step might be a better way of looking at it.
Well, and I think that could also tie in with what Jim had mentioned earlier about putting some of that information out on social media. I think that's another way to do that because as I stated, I've seen some Facebook posts from some restaurants and they've made it very clear that this is what we have in place to protect you. And they're making sure that the customers are aware of what those safety precautions are, including the requirement to wear a face covering until you're seated at your table. So that might also be another way to get some of that out there. And maybe if there were some interest in restaurants coming together and getting that unity that was mentioned earlier, that might be a good way to do that.
So Martha, I hate to put you on the spot, but I really think Brett's idea is really interesting. And looking at what role the health department has played through this really critical time. And again, thanks to you and your staff for the great work you've done there. But it sort of seems on the continuum of the kinds of things that the health department does as a matter of course and again, it doesn't need, I don't think, to be an endorsement. Can you see any way forward to, if you have a list of requirements of publishing the restaurants that are complying with those or that have responded that they are complying with those in some way, to sort of give this an official thing? I really like Brett's idea as opposed to coming down with the hammer, to really promote those businesses that are making, taking the extra effort, going the extra mile to make sure that their customers are safe.
Yeah,
I like that. I like that idea as well. And I think it's something that our group can have a conversation about and get back to you guys on. Because keep in mind, just like some of your customers vote with their feet where they decide to go based on what's going on, we have elected officials at the county that people actually vote on a piece of paper, and that's coming up here in November. We have elected officials that answer to the public, and I think that we need to keep that in mind as well when we're putting something together. So I'm not elected. I can be, as specific as I want, but when we're using resources of the county to do something, I think that we need to be somewhat sensitive to that.
What about some sort of self-certifying list? If between the health department and the restaurateurs, the rules that the health department EOs have, plus is there a list additive to that the restaurateurs want to agree to? Here's the voluntary things we all agree to, and they self-certify that they're doing it. And again, if anyone gets busted, you can take them off the list. But again, they're that way, there's really no bad guy
but maybe we take it one step further, and Martha's group, and I realize it's a lot of work, but I'm thinking about your restaurant inspections. You don't mind printing those in the paper that said, they got so many demerits and this is what happened. People really look at those things. So maybe it's as simple as, the rules that you talk about, they have to, like Dave Horseman, the things that he's doing and the other people on this call are doing, and you can put on your social media of not only the things that you're doing, but up at the top, certified by the Lenawee County Health Department as COVID-19 compliant,
And again, Jim, I'm open to that. I think that we need to have a discussion about how we would structure it.
Sure.
I like the idea. I like the unity idea, and I like the idea of putting something out there. I think we just need to discuss the fine points of how we accomplish that.
Well, good. Okay, good. We'll wait to hear from you. That's a good idea, Marty. Okay.
I think this is Angie from Boot Jack Tavern. I think a good start would be if we could get a message from the health department or Lenawee leadership to send on our individual business social medias, because I think, like my social media is my target market. So I'm struggling with two things. One, my customers do not want to wear masks and comply. And two, my customers are telling me all the time that I'm the only one making my staff wear masks. Now, I admit I've been pretty overwhelmed these last couple of weeks, so I haven't myself been to other restaurants. But I've had customer after customer tell me, why are you still making your staff wear masks? Nobody else is. And it's very frustrating.
So we were also hearing a big one from local restaurants, that people claiming that Ohio isn't enforcing anything, and that then we're losing all of our business to Ohio because their staff doesn't have to wear masks and people don't have to wear masks. So when we reached out to them through social media, they all said they actually do. And in fact, some of them have hired a person specifically just for enforcing masks there. They are placed next to their hostess, and they've been mostly bouncers from closed clubs in the area. So don't believe it. We've looked into it, and most people are sticking by it.
And just to add to that, I have had that conversation with multiple restaurant owners, or the environmental health staff have as well, where they're being told by customers, you're the only one that is making people wear a cloth face covering. So there are other restaurants that are indeed enforcing that requirement. So I would just ask you to stay strong on that one, because it truly is important as we move forward.
I agree.
And we're very open to trying to figure out what we can do. As Marty said, we can have more conversation on that. We are open to being able to try and make this a better situation, and continuously looking at that messaging piece.
I had the opportunity this weekend. Hi, everybody. I'm Stu from Aubrey. Sorry, I got on the call a little bit late here. I had the opportunity to go to Traverse City this weekend, and they did a very interesting thing downtown. Now, all their restaurants are kind of in one location, basically. But they had like those sandwich board signs, like pretty much on every street corner, that said, it was kind of like branded from Traverse City, and it just encouraged everyone, for the safety of the employees that are there. Obviously, it's a hub for a lot of places, a lot of people to go visit. But they used a lot of like physical, messaging there downtown as a way to kind of help people rally together. And another thing I saw was that every restaurant enforced it. And so every restaurant, every shop. And so it wasn't uncomfortable for a restaurateur or a hostess to have to turn someone away for not wearing a mask, because every restaurant acted that way. And so just kind of further echo everyone's point today, I think it's going to be pretty critical that every restaurant still stand together through this and enforce it. And I love all the ideas that are here today. I apologize again for not being able to be in the front half of it, but by the end of the weekend, we probably visited 3-4 restaurants, and you just got used to it because everybody did it. So I don't know if that's something we could consider from a physical messaging standpoint.
Were the breadboard signs more sort of on the corners, just sort of here's all the rules that everyone's following, just so anyone walking the street sort of gets the clue that you've got to have a mask on, Bubba?
Yep. You couldn't miss it.
Wow, that's relatively easy to do. Yeah. And no one's being a strong person. I mean, you're just sort of reinforcing we're all playing together.
Yep. Lots of signs, no mask, no food. Definitely. And then, a lot of their a significant amount of the restaurants actually had sections roped off inside of it. And, most of them had hours that were a little bit earlier. And they did have, I couldn't speak to if they were dedicated people to clean the restaurant with bleach. But every restaurant that we went to, you could see someone that was spraying your table down completely wrong. Even, at one point, someone in our party actually got some overspray from someone cleaning a table, unfortunately. But yeah, it's a very visual way to do it. But again, everybody was doing it though. So every restaurant was in, every business owner was in from a storefront perspective. And I think that that definitely helped everyone across the board.
Stuart, it's Chris. Just a clarification question. Was the signage like restaurant based, or was it community based? So was it community
based? Yep.
Okay.
Yep. It was branded as the city of Traverse. It was really clean. It was like a really clean looking sign. But yeah, it was definitely. Because it does.
Stuart, thanks for sharing that with us.
Yeah, absolutely.
Somebody was jumping in there. Somebody have a question? Okay, well, we've recorded this, and we'll be working with the county and the health department and our other partners, Chris and Tecumseh and the other ones, as we move forward. We haven't planned on having another one of these right away, but if something comes up and we do put something together, we'll get the notice out to everyone, and we'll try to assemble the group again in the future.
Thanks, Jim and Tim and everybody on the call. Really, again, appreciate the county being here in force and the leadership. Thanks, Martha and Casey and Marty and Kim. Really appreciate all of the work you guys have done in this challenging time. So,
thanks, Chris. Yeah.
Good job.
Thank you, everyone. Thank you for everyone for jumping on. So we'll keep in touch.
Thank you.
Thanks, Tim.
Okay.